Other questions? Yes?
Are there people in your respective congregations that do not support the public option? And if so, what do they say in response to this?
I'm sure there is a diversity of opinion in congregations. I guess the question for me is, given the unanimity of our religious traditions on this issue, about the accessibility and the affordability and the quality, we might argue about public and co-op and so on. But the larger question is, why are so many Americans, I trust not a majority, I think the majority clearly in the polls favor the public option. A clear majority, substantial majority. What is it about our common life that finds resistance to it when there is so much support for it? That is not to put down those who oppose it. But there is something going on in terms of either the Congress or the way we are governing ourselves that is troubling in terms of our leaders not being responsive to what the people are saying. I know that doesn't address the question directly. I think I do one more answer to that, and that is, it's a question as well. Where is the resistance to healthcare reform itself? And I have to wonder whether there isn't some other religion operating that trumps the religions that we represent. That is a deeper commitment to values of competition and greed and lack of care for those beyond ourselves. If there isn't operating in our body politic, in our common life, some fundamental religion that says we don't and shouldn't take care of one another. If that's the case, then those of us here and those of us in this congregation have our work to do as a kind of, excuse the Christian language here, evangelism.
Yeah, I don't think I disagree with what my colleague has said, but I would supplement it by saying that often one could argue that the opposite of love isn't greed, it's fear. And I think what explains a lot of the resistance on the part of people in our society to public option, or even to broader health care as it's being proposed with or without the public option, is the sense I may lose what I have. Something's going to unsettle this system that will take away what I have, even if it isn't perfect, I've got it now. And so change is frightening to a lot of people, or unsettling, and so I think it's fear of loss as much as it is greed, even though both are operative.
If I may add, so another Jewish saying, 2 Jews, 3 opinions. So I'm not going to assume that I can speak for any other person in the Jewish community about this, but at a very basic level, I think that there is agreement that if I were to create a society, I'm speaking Jewishly speaking, if I was to create a society, why would I create a society or set one up in which 1/4 of the population is threatened with illness? Of what value is that society? And the current proposal, at least the last one that I saw, that says that they're going to cure it so that only 6% of our population is being left out. What kind of society do you want to create that leaves, at least in our society, 18 million people, currently in the last numbers, sick? So we can disagree, as the Reverend mentioned, about the details, but on a very basic level, and I'm not going to use the word moral because that has become such a weighted term in our society, in a very basic, practical, and I will say Jewish level, and speaking about the we, when you're creating a society, why would you want to leave a segment of the population at threat or at risk? It benefits none of us.
Yes?
Well, along similar lines, would you say that it's immoral to profit off of sick people in the same line that it's immoral to profit off of war?
I can only speak for myself.
Of course.
And that is, I think it is immoral. It is to profit from people being sick or guaranteeing their access to health care is an immorality because it violates a fundamental human right. It provides the opportunity for the violation of the human right, what people deserve. In my tradition, in the Christian community, we just had a reading that we used a couple of Sundays ago about a rich person coming to Jesus and asking about eternal life, and Jesus says, well, have you followed the 10 commandments? And the person assures them that he has. And then Jesus said, but there's something that isn't covered in the 10 commandments, and that is your capacity to love everyone. And what you're guilty of is defrauding people of what they deserve. If you're going to have eternal life, you got to pay back those people you've defrauded. And in a sense, that's what's at stake here. We have denied people a fundamental right. We have defrauded them. And it's now time to make good on that fraud.
I think from an Islamic perspective, there are 3 things that are people's rights and also duty and responsibility of whatever authority human beings set up to govern themselves. And that is, healthcare is one of it. The second is education, that people have right to education, people have right to healthcare. And third thing, people have right to justice, that if something wrong is done to them, they should be able to obtain justice without having tons of money to spend on it. So these 3 things are considered the rights of people that must be given to them, and the state or authority that is on them is responsible for those rights.
I think that I would say Jewishly, that's a really loaded question. That's a really loaded question. So I can think back to the shtetl life, the small community life in Judaism, in which if there was a butcher on a block, another butcher wanted to come and set down a shop, that was okay. It wasn't preferred. Of course, the first butcher wasn't that happy about it. So I think the ability to make a profit's okay, but to what extent? And if it's a matter of driving people out of business or driving people so that they can't afford basic necessities, so they have to make the choices they have to make between feeding their children or paying for their health care or what have you, then there is a moral component, as much as I stay away from that word. So I think that being able to make a profit is good, but the question is to what extent. And when you don't have regulation in that, it becomes unbridled, people suffer because of it. So I think that, Jewishly speaking, I've said it enough, so it is a word. Jewishly speaking, make a profit, but there is enough. And when is there enough?
And the basic distinction is between accessibility for those who otherwise wouldn't have access to health care or education or food or the basic things that sustain our lives, and on the one hand, which I do believe in, and whatever befalls those who provide those services, and on the other hand, I think that's the fundamental distinction.
Yes, I think, we outlawed the poll tax. We said the right to vote was unencumbered by payment. If health care is a right, it ought not to be involved in whether you have the capacity to pay for something that someone will make a profit from.